Good afternoon, everyone. I'm super excited to have a special guest with me today, Dr. Sevier. As you guys know, at Back to Normal, we are always looking for the most innovative, game-changing types of technologies and treatments that really help our patients get better quickly, get them out of pain, and back to the activities that they love. And I met Dr. Sevier several years ago. He is an orthopedic and sports medicine physician. He's a medical researcher, and he is one of the main people who helped get Astym off the ground. So I'd like to introduce Dr. Sevier. Maybe just tell us a quick little, how you kind of, came to bring Astym to the forefront and kind of where, you felt it was needed in our medical practice.
Well, I'm an aging athlete. Years ago, I was a basketball player at the collegiate level. And I was one of those guys that just had to work really hard to keep up with everybody else because I didn't have the talent, but just sort of got myself beat up and ended up with a lot of problems with chronic tendinopathy, a lot of knee issues, things like that. Sort of struggled with that. Of course, decided, well, obviously I'm not going to be able to play basketball for a living, so I went to medical school and got very interested in medical school and several different things, but I was exposed to some great physicians, some people involved in sports medicine throughout. And then I did a residency and it just sort of went from there. I just was always attracted to the athletic group. And I think a lot of it was, I was trying to figure out my own issues. And I got in I did a residency, and then I went into a fellowship, which specialized in sports medicine. And I was exposed to some very gifted manual therapists at that time. Some of the people that were celiacs trained and things like that. And I still have my knee problems and my tendon problems. And so long story short, that helped open my eyes because physicians often, as you know, Lisa, better than anybody, physicians really don't get a lot of exposure to physical therapy, don't understand what physical therapy can do or how much it can help their patients sometimes. And boy, it really opened my eyes and made a huge impact on me. So I started really getting interested in different types of physical therapy and different kinds of treatments for tendon problems specifically. Tennis elbow, Achilles tendonitis, jumper's knee, all these things that drive IT band, all the things that drive everybody crazy. Over time realized that, we really don't have very good treatments for this. We're not that effective. We give everybody anti-inflammatories, we'll give them some steroid shots. That's what a lot of times what the docs do. We'll try to rest it better. Yeah. Which when we try to rest a tendon better, it's only better while it's resting. Right. You never get back to the activity you want to do. So I kept thinking, in my background, I had a little bit of background in immunology and infectious disease, as well as on the body's immune response and healing. And so I was trying to think, we need to figure out a way to actually get the body to help heal itself. We need to stimulate, because we do all these things to try to help guide things while people are healing. We try to get them to move right and exercise right and move while they're healing, but we really can't do a lot to stimulate that tissue to actually get healthier. And so I thought, boy, if we could figure out a way to boost the body's own healing response in these tendon problems and make that tendon regenerate, so to speak, and get stronger, tougher, better able to handle the demands that we want to be able to put on it, people could get back to sports and doing the things they haven't been able to do for years. And we could almost, the whole idea was to rejuvenate the tissue and make it young, act like it's younger and healthier. So that became my focus, and that became just a passion. And of course, I needed a lot of people with a lot of other knowledge outside of my area. So we got involved in people that had a lot of experience with bioengineering, biomechanics, exercise physiology, biochemical immunology, and really put a team together. And I think what was great and how Astym came about is we put a multidisciplinary group of experts together that had all kinds of different perspectives. And we all came together focusing on the same, how do we make this happen? Can we make this happen? And then over time, we figured out, and we thought, this ideally needs to be brought out through physical therapy. So we need to figure out some kind of physical therapy treatment, hands-on kind of thing, where, that we could stimulate the body to heal. And so that's where it all came about. And then over time, it took us about 10 years. We did a lot of work on on rats. And a lot of rats got their Achilles tendons healed, got how to get their tendons better. And then we started bringing that up to the animal model, higher animal models. And then we did some work on canines and overuse, like race dogs that had been overused, horses that had been overuse injuries. And then we were able to start trying protocols on humans, and we had just tremendous success. Initially, we had a lot of great responses, and then some not so good. And we kept working on that and kept modifying our protocols as we kept trying new things. We kept track of the data. And then over time, we were able to figure out how to make it better. I always talk about it's almost Astym's like a recipe. It's a way of doing therapy. It's a very specific recipe of if you do this, 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 and this in this way, you will get this result. It's like baking brownies.
Yep.
Everybody's got a brownie recipe.
Yep.
Boy, there's some people that can really make good brownies.
Yep.
People's brownies, they're brown, but that's about it. But if you want to have so our focus was to get the same good results every time a patient came in, get the most out of every treatment that they got, so they get the most improvement, and you can get, in other words, you can resolve your problem in the least number of visits, and get back to doing the things you really want to do and not have it come back. That was the other thing too, is we really worked on, if we can stimulate that tissue to get back to normal and healthy, you go back to your activity, especially if you've had a good therapist guide you through like you do, and you get people to be active participants in their recovery, you get them moving right while they're healing. The body adapts to the stresses we place on it while it's healing, and Astym stimulates healing. That's the thing Astym does. That's what we call it, Astym, a stimulation for healing. Astym will boost and stimulate that healing process. You as a therapist guide that healing by loading those people, exercising those people, getting those people moving in the right way. And when they get done with therapy, they're back doing their normal activity, and they don't get recurrence. It doesn't come back because now their body's adapted perfectly to that activity.
That's right. So for those that don't really understand what Astym is exactly, let's talk a little bit about, well, what is it? You mentioned a little bit about how it works. Let's just get into a little bit of the details of that. So those that have maybe never been exposed, whether it be therapists that are following us, or it be patients or physicians, let's kind of, just dive in a little deeper as to, okay, well, what's the process, about the instruments that we use, and how it actually does that stimulation within the body, to accelerate that healing.
Well, and you hit it right on the head. Astym is a process. It's not and we use instrumentation, as you know, to deliver certain forces into the soft tissue. So instead of using your hands or thumbs or your elbow or whatever, trying to do manual types of therapy, Astym really steps away from the manual therapy, not only in the fact we use instruments, but we actually we're trying to do something with the instruments a little different. The instruments are just there to stimulate the tissue to release growth factors within your own body. It is basically stimulates your own immune system, your own body, to release healing growth factors within the very tendon or within the area that's injured or has a problem. And those growth factors cause cells to regenerate and heal very quickly. It almost doubles healing time in an acute injury. A new injury can reduce an injury. Instead of taking 6 weeks to recover, it'll take you 3. It cuts it in half because it really is a boost to healing. In a chronic injury like a tendon or what have you, it stimulates that tendon to go from a degenerative, unhealthy tendon back to a healthy, normal tendon. So that's what happens. We do that through a very specific protocol that's been worked out, and there's a certain amount of strokes that occur. The instruments are applied by a therapist, utilizing them across a person's body, across the area that's injured. And we treat the whole, like if your elbow is injured, we treat the whole arm, from the fingertips all the way up to the shoulder. We treat what they call the whole kinetic chain, which means the whole movement chain. Because you may have a sore elbow, but guess what? There's a shoulder connected to it, and there's a hand connected to it, and it all needs to be treated, or you're setting yourself up for a problem somewhere else. Same thing if you have a problem with your knee or your ankle or whatever. You've got to look at the whole leg, the whole thing, to fix the problem, as you know. So Astym is very much based on treat the whole extremity, stimulate that tissue, release those growth factors, which cause the healing. And we use instruments to do that because that's a very efficient way to do it. And the instruments were designed just to stimulate the tissue to heal. Now, again, what's different about Astym, you'll find there's people out there that have tools to do massage. There's all kinds of tools out there. People say, oh, instead of using their thumbs or elbows, they'll have a tool, and they call it instrument assisted or instrumented soft tissue massage or mobilization, IASTM. You may see that out there. That is not Astym. Now, there's instruments involved. That's about the only thing that from a distance you may think, oh, there's instruments. It must be the same thing. Not even close. The instrument assisted soft tissue mobilization is very mechanically focused. And there's nothing wrong with a mechanical treatment when you use your thumbs or you put your hands on a patient. That's really good when a therapist does that. But when a therapist starts picking up hard metal objects and hard objects, and instead of using their hands, they're starting to manipulate or try to go deeper and harder and think that that's going to get a good result in a patient, really doesn't. Got to be really careful, because if you get too aggressive with these things in your well-meaning attempt to try to get the healing to take place or to break down scar tissue or whatever you think you're doing with those tools, you're going to hurt somebody and you're going to hurt the tissue. And if you traumatize the tissue, which you will, you get more inflammation. If you get more inflammation and damage the tissue, you start chasing your tail. So you're actually damaging the patient as much as you're helping them. And that's the problem with the IASTMs. They're not standardized. The other thing is the mentality is they're mechanically, then there was, okay, there's a problem with the tissue. There's a lump there, a piece of scar or a lump in the tissue. The mechanical approach of IASTM is like, I'm going to take my tool and I'm going to massage it really hard. I'm going to try to, quote, break up that scar tissue. Well, anyone that thinks about it, I mean, scar tissue is like Kevlar. It is so hard and tough. It's way tougher than normal tissue. And if you try to get in there and try to break up mechanically scar tissue, you're going to damage all the normal tissue around it way before that scar tissue is going to break up. And in fact, there's a lot of good research out now that shows you can't mechanically break up scar tissue. And I can tell you from a surgical standpoint,
right?
You open it up, it is hard. You just have to cut it out. I mean, it's that dense. So the nice thing about Astym, we get away from trying to get in there and go deep and go hard. Astym is more of just, we're trying to stimulate the body physiologically. We're stimulating a physiologic response, which means, like I talk about, a healing response. We're stimulating your own body to start that healing response. So for an example of scar tissue, if you have a lump of scar tissue in your muscle from an old hamstring injury or what have you, instead of us getting in there and trying to mechanically really deeply massage it out, as people have always done for years, Astym, you would stimulate that area with Astym, and then you step back and stretch it and make sure you load that tissue. But the Astym will stimulate that scar tissue to go away. It will actually stimulate the scar tissue to resorb. We're not trying to break the scar tissue up at all. So we don't have to traumatize people. And I always tell people, you don't have to hurt people to get them better. You know, and Astym will stimulate that tissue, and the scar will just melt away over a period of a few weeks. You know, it takes about 4 to 5 weeks, a couple of times a week, and you can get rid of 95% of that scar tissue. It's just gone. And which changes everything, because all of a sudden now we can stimulate scar tissue to go away for people that have had trauma, injuries, surgery, and again, so often, you know, people will heal after an injury. People will heal after surgery, but no matter what we do, sometimes people don't heal correctly and they heal with scar. And a lot of times the only thing standing in the way of a good result from a good surgery is the scar.
Yeah.
It's the only thing standing in the way of a good outcome.
Yeah.
And all of a sudden now you, because you're Astym certified, you as a therapist can now stimulate that scar tissue to go away. And that's why it's so important to get Astym out there, because there's so many people out there suffering every day from old injuries that are haunting them. And they're haunting them because there's scar tissue. Old surgeries they had good surgery, they just didn't heal quite right. You know, they had some scar tissue. We can get rid of that. You can get rid of that. And the nice thing is, with Astym, we can stimulate that healing and resorption of scar tissue even years later.
Yeah.
It's not like, it doesn't have to happen within the first week. We could take someone to spend 20 years put up with something. They get in, you see them, you can clean that up. And all of a sudden they're like, oh my gosh, and of course then they're like, why didn't I know about this 5 years ago? That's why I say it's our job, and what you're doing right now is so great, is getting the word out to people that you've got an answer for so many problems that so many people have in your community right there.
Yeah.
They don't even realize that they could be fixed just by coming in, seeing you, getting something that's safe, effective, non-invasive,
Yeah.
and it works quickly and has a high % success rate. Why not try it?
Yeah,
Nice.
absolutely. Well, and what you said about scars, it is so true, because I have a cash-based practice. And so I tend to see people who have had everything under the sun, from injections to surgeries to multiple PTs to chiropractic to acupuncture. They've had everything.
Mm-hmm.
And they're so frustrated and they've lost hope, but somehow they heard about us. They've come in. And I can tell you just our approach of really trying to look at the whole entire body and try to figure out what the cause is. And that scar is almost, I would say 95% of the patients I see that have old scars, abdominal surgeries, but they're coming in with low back or hip pain. They've had shoulder surgeries, or they've had their chest opened up and have scar tissue.
Yeah.
And nobody has ever even looked at, assessed, or treated, even thought to treat the scars. And as soon as we start to treat the scars, we treat the whole approach by treating, treat the whole body by addressing multiple things, including the Astym. Oftentimes somebody comes in with a shoulder problem, I will do Astym not only on the upper extremity because they have a shoulder problem, but I'll go down into the lower extremity. Why? Because if they're a tennis player and they can't load through, maybe they had an old ankle injury or an old tendinopathy of their knee. And by the way, oh yeah, my knee does kind of hurt as well. And now you have to treat the whole lower so they can load, improve their mechanics. So now they're not overpowering into the arm. So it's a whole approach. I love how just Astym integrates into what I already do, which is looking at the whole picture, treating the whole system, and really, getting people active. And I love how they can stay active while they're in the rehab. How many times do you have, athletes sometimes don't like to come to therapy because what the therapist says is you need to rest. And granted, there are times when rest is truly indicated, but when it's a tendinopathy like we're talking about, those soft tissue issues, we really want to keep them active as soon as possible and load that tissue so it will start regenerating or reabsorbing in a much more efficient, faster way. So, yeah.
Well, you hit it on the head. In fact, the thing is, since we are stimulating a healing response, the body truly adapts to whatever stresses you put on it while it is healing. Yeah. So if we're stimulating and really ramping up that healing response, we better darn well make sure that we are having the patient or the person doing the activities that they want to do eventually or ultimately while they're healing, because then that way their body will adapt perfectly to running or perfectly to playing tennis or whatever activity that they're wanting to ultimately be doing. So as soon as we can, we're getting people back doing the things that they want to be doing while they're getting Astym, while they're seeing you, and it leads to a better result, much better result. Absolutely. And that's why people don't get recurrence. It never comes, it just doesn't come back.
Yeah, nice. And I always really try to emphasize that, I'm like, okay, I'm going to start this process, which will continue to stimulate in your body for weeks, as we know. But what you do every day is so critical to the success. If you want to get better quicker, then, we say, okay, 3 to 4 times a day, you're stretching, you're hydrating, you're putting, good, foods and nutrition into the body. So because we're stimulating that process to repair. So the more you can assist your body in that repair and that loading phase, the quicker. And I see it in my patients. Those that, are not as consistent with their program take longer. Those that are just right on it and doing everything I'm telling them to do, boom, within a couple weeks, they're like, wow. I really, within one session, they can start to feel a huge difference. And then it just goes from there.
Well, I think that's what's great. What you do it back to normal is exactly what, and I think all physical therapy tries to do what you're doing, and that's the goal of the physical therapy profession. But you do it incredibly well because you just really demand that your patients become active participants in their recovery. Yeah. It's not, okay, Lisa, fix me. It's you're not, no, okay, I'll help. I'm gonna tend you while you mend, I'm gonna help you along. But they've got to do it. And you're right. Yeah. What they do in response, and the guidance that you give them, and the better they comply, man, the better they're going to do.
Yeah,
So
true. So let's talk about, the different treatments that are out there where people have had particularly tendinopathy issues. They've either had surgeries, they've had injections, they've had even physical therapy, and they have not been successful. I know that Astym did some research that looked at those failures, and when Astym was, introduced later, in the process, how it was able to resolve the problem. Tell us about that.
well, and what's interesting, what you bring up is, yeah, we've collected outcomes data and data across like over 10,000 patients and cases with all different kinds of scenarios. And we basically pulled out the data looking at people, because Astym, the reason Astym is so incredible, and the reason everybody talks about Astym that hears about it is, and like you are excited about it as a therapist, because it allows you to do things that just before were very challenging or just didn't happen very often. It was, in other words, the things that we were doing, it's almost like when I was back years ago when I started getting into this area, I was like, boy, a lot of these things that we're doing just aren't that effective and don't get the result. And it's a shame people spend a lot of time doing this. For example, we as physicians, and you still see it today, for a chronic tennis elbow or a tendon problem, the easy thing for the orthopod to do is whip out the corticosteroid injection or inject you. And unfortunately, they're using corticosteroids, which it may, quote, calm it down or make it feel better temporarily, but it does not fix the problem. In fact, long term, it makes the tissue even weaker.
Yeah.
So you never really get over it. It's just a diminishing returns and unfortunate. So again, corticosteroids decrease healing response. Astym stimulates a healing response. So the Astym, again, being able to bring in some treatment that actually can stimulate your body's healing response changes the whole game. And that's why Astym is so effective. You have someone who's failed a couple of corticosteroid injections, they come to you. Yeah, it's a little tougher to get that tissue to respond because the steroid is trying to hold it back, but you can still get it to respond. It takes a little longer, and then boom, boy, they heal up, and it changes it. So again, Astym will help people that have failed corticosteroid injections. Astym will help people who have failed physical therapy somewhere else where they haven't had any exposure to Astym. And I don't care what they've done to you. If they haven't done Astym, you haven't gotten it from an Astym certified therapist.
Yeah.
You have an Astym. I mean, you need to see an Astym certified therapist who knows what they're doing, like yourself, who can actually get the body to do what it's supposed to do. Because Astym's a process. It needs to be delivered by someone who's got the knowledge, who can deliver the treatment correctly and then in the right environment, like you've talked about. Yeah. So again, even just because you failed therapy, it doesn't mean you've had, quote, bad therapy. You just didn't have the right therapy.
Yep.
And so get in and get it. Now for the areas of, like, for example, I'm going to shift gears and go talk about, like, well, we talked about splints and brace a little bit earlier because we said you can't rest a tendon better.
Right.
A lot of times people will say, oh, let's put you on some splints, let's rest it, let's brace. Again, you may make it feel better temporarily, but again, it will never get better that way. Our whole goal is to get your tissue better, get you out of splints and braces, because that can lead to more problems. Now, shifting gears a little bit, going to surgery, or people that have had where Astym has an impact on surgery, and we've had some great publications. I mean, I encourage anybody that's interested in research, just go to PubMed or go to the internet and just pop in Astym therapy and just see what pops up. But we've had some fantastic articles published by large orthopedic centers, Cleveland Clinic, Sinai Center, NYU, on the use of Astym as a rescue therapy or salvage therapy for people that have undergone total knee replacement that has gone bad. In other words, you've got a total joint, now you get a bunch of scar tissue that you can't move the thing, it's stiff. The Astym protocol can completely reverse that and give those people the outcome they should have got from their surgery to start with. Yeah. So it can be a true life changer. And I'm sure you've seen these kind of patients in your own practice. But
absolutely.
The thing about it is, like I said earlier, that with surgery, the people that, quote, failed surgery and then got Astym and then got better, it's not that they got bad surgery. It's just when they healed, the healing didn't go well and the person got scar tissue. And that scar tissue is in the way of that joint moving. The joint's healed. The x-rays may look really great, but they can't move their hand because it's all scarred down.
That's right.
So this way, you as a therapist can clean up all that scar tissue, get the soft tissue moving correctly. And once you get rid of the scar tissue, they get the outcome that they should have got from the surgery to start with.
Yeah.
So it's just, it's just because Astym brings something to the table we didn't have before. Before, we never had anything that could stimulate a tendon to heal. We just didn't have it. Nothing we had. Physicians didn't have it. Therapists didn't have it. No one had it. Now you, as an Astym certified therapist, have that ability. Second thing, no one has an answer for scar tissue. They're still trying to figure out what to do with scar tissue. There's all kinds of barbaric things that we do sometimes with scar tissue in the medical field, I can say that. But we either cut it out or we try to break it up or do something surgically. But now Astym changes the game, because now someone can come to you or an Astym certified therapist and actually get that tissue stimulated. The body will actually resorb the scar tissue without having to cut it out or pull on it or tug on it or do all these other painful, uncomfortable things. Yeah. And once that scar tissue resorbs, the pain goes away, the movement comes back. It just changes what's possible for patients and for you to do for patients.
Absolutely. Absolutely. And I see that every single day. So let's talk about where maybe we've done Astym and maybe we're at, 85 to 90% resolved, but there's still that 10%. We've talked about PRP and stem cell, and I've got, some colleagues that, in the area where we collaborate, and I've seen really great results. Sometimes that tendon maybe needs a little help. Talk to that and how Astym works in conjunction and when it's time to kind of go that route.
Well, see, I think, the PRP is basically platelet-rich plasma. And it's basically where a physician, instead of putting steroids, corticosteroids in their syringe, they're putting in platelet-rich plasma. And you think, well, why are they putting in platelet-rich plasma? Well, platelets release a growth factor that's very potent in making the body want to heal.
Yep.
Now, it doesn't last long, and you can only get it by mixing up platelets and combining it with some chemicals, putting it in a syringe and squirting it into somebody, and you got to do it really quick. And it only works on a really tiny area, okay? So anyone that's getting platelet-rich plasma or going to someone that's getting platelet-rich plasma injections, that physician needs to know exactly where that needle is, and that needle needs to be right on the spot where the tendon's the most unhealthy. And the only way you're going to know that is to image it. So they will probably be using ultrasound imaging at the same time they're sticking the needle in, so they can see on the screen where that needle is, and they put it right next. And if you get that platelet-rich plasma right on that sick spot, then those growth factors from those platelets can make that tendon jumpstart the healing process. But it only works on an area about a half square inch.
Sure.
Okay. Now remember, we talked about earlier, and that's where, so that can be helpful to boost that spot. Doesn't do anything for the other spots, doesn't do anything for the arm or the rest of the tendon, but that little spot can really boost it. And again, if you're having trouble with that, it's great. And what's nice about it is Astym is a physical therapy treatment to stimulate tendons to regenerate and heal. And we do it through making your body release growth factors. Well, PRP is where the doctor takes out some of your blood, spins it down into the plasma, concentrates those growth factors, and then squirts it back into your body.
Yep.
Okay. But they both are working on growth factors that will stimulate healing. So they're synergistic, meaning they can work very well together. And the beautiful thing about, and all my colleagues that do PRP, when I give lectures and talk, I always talk about, PRP is great. It can do certain things, but I'll tell you what, your outcomes will get so much better if you get them in the hands, inject them, but then get them in the hands of a good therapist who's going to guide that healing and get you a better result. And that's where, again, the combination of PRP plus good physical therapy, and if you combine Astym therapy with the PRP, oh my gosh, tremendous double healing effect. So it can be very good in that situation. It can be good, like you talked about, you can either do it before or after. In other words, PRP can be done first, and then you can start Astym 7 or 10 days later once the irritation settles down from the PRP. And then you can treat the entire arm, treat the rest of that tendon, get the whole arm healthy, because now the PRP's got that spot healthy, but now everything else needs to be cleaned up too, and you get a great result. Or you can do it the other way. You're, as a therapist, have a patient come in, you get Astym, and a lot of times, 90+% of the time, Astym's all you need.
That's it.
But if you're one of the 9% of the people that don't get completely resolved, then it's like, okay, now what's great is you as a therapist have cleaned up all the other stuff, and you've got it down to that one little spot.
Yep.
And that's, now it's great for the PRP physician, because it's like, okay, now I just go in and find that spot.
Right.
I nail it with the PRP, we're done. You know, so it works both ways. You can either get it first or second.
Yeah.
I recommend, because I think therapy, again, non-invasive, it just makes more sense. Try therapy first. If the therapy doesn't resolve it, then go PRP. If you've already gotten PRP and you've been going that direction, there's nothing wrong with that. But make sure you get into good therapy with an Astym certified therapist like yourself, to make sure you get the most out of the money you're paying for that PRP, because you're paying a lot for that PRP.
Absolutely. Like you said, it's just addressing one area, and we address the whole kinetic chain, because that area is the victim. That's what's gotten, you know, stressed and is painful, but it's often up or down the chain where there's a bigger issue, or that whole connective tissue structure is just loading that one area.
And you're so right. And you had such a good example. I know you've had so much experience with professional high-level tennis players and other athletes, and you're absolutely right that it's, if you don't address the other things, if you just try to, and again, I'm a physician, we're the worst at treating the spot. We always are looking for, where's the diagnosis and where's the spot, and we're going to treat that spot. Because now I know where that is. You know, we'll do surgery on the spot.
Right.
We'll put the injection in the spot. But we forget there is a whole arm connected. There's a whole body connected to that spot. And again, that's where it's so critical, like you're saying, that you've got to treat the other things and get that cleaned up. Otherwise, this is going to come back. Yep. Because we didn't address what caused this to start with.
Yeah, absolutely. Now, I know we've talked about the safety of Astym as being, it's very safe. You know, you can even use it on a 4-month-old you were talking about. Maybe mention just, you know, from a safety perspective, because like you said, different, you know, you see different things about instrument, you know, assisted and whatnot, and the safety. Right. So I just want to touch on that, because I have found it to be, I can use it on really any, you know, patient. It's super, super safe, as long as you're obviously certified and you know how to apply the treatment. Yes. Right.
Yeah. And it really is. It's the knowledge that your therapist has that's critical. The challenge is with the instrument assisteds, or the IASTMs. Again, training is poor, it's inconsistent, and it's this mentality of, we're going to mechanically break up tissue. We're going to bust it up, beat it up, and we're going to change it and pull it apart, or whatever we're doing, we think we're doing with scar tissue. It's barbaric. I mean, it really is. And I hate the fact that there are people out there, well-meaning people, that are they just want to get better. And they're thinking, oh, I'll go do this, or they've been, somebody will say, oh, I've got these tools and I'll just, you know, I'll fix it. It's like, if they're not Astym certified, go the other way. It's your body. It's your money. It's your life. You deserve the best treatment first. Don't, you know, waste your time, energy, money. Plus, there have been quite a few cases where people have been injured because of the trauma that comes from somebody trying to do the aggressive massage with tools. So just stay away from that. Be careful. The great thing about Astym is all the research studies we've done, every one of them, part of what you do when you do medical science, and again, that's the challenge with some of these tools out there. You just got people manufacturing tools and sell them to whoever without any kind of control, quality, or anything. Our instruments, I'll just hold one up here. Our instruments are basically, these are registered with the FDA. Okay, these are medical devices. All right, they're not just some tools or something somebody made in the back. You know, these are, and knowing what to do like you do and applying it correctly and again, we're not trying to mechanically change the tissue. All we do is stimulate the tissue and then step back and guide it. And that's what you're talking about, the safety. Every study, safe and effective. We have never had an adverse outcome in 15 research projects with multiple patients, multiple age groups, from 84-year-olds getting total joint replacement to little kids. I mean, safe and effective across the board. And I'm proud of that. because again, and that's part of the reason we spent so much time when we developed this. We want to make sure we're bringing something forward that's going to get great results, going to be very cost effective, and it's going to be safe, and it has to be safe. So yes, you're right. And what's amazing, we see this 4-month-old babies with torticollis. They're, torticollis where they're stuck down. You can just clean that up in no time. It's amazing. Little kids with cerebral palsy, we've had good success with neural effects of Astym, and I know this is not part of this talk right now, but we've had some incredible effects for neural problems that are really helping move the needle. It's not the complete answer, but it sure changes what's possible for physical therapists to do for these kids and improve their function and their ability. So with some of these neural problems. So I mean, I'm excited about those areas, and again, those areas are getting more research, but it's fascinating. And then again, it is safe to use on grandma. It's good, safe to use on 84. We've had 84-year-olds, total joint replacement. It works beautifully. So it's safe across the board for all kinds of different age groups, all kinds of different medical conditions. Obviously, there's certain situations where we can't use Astym. If somebody has an open wound or if somebody has an infection in their tissue or something like that, obviously we're going to avoid that. But boy, once people's like incisions are healed up after surgery, or somebody's having in general, there's very few cases. Sometimes if somebody has trouble with maybe a bleeding disorder, somebody has hemophilia that's not well controlled or is on a lot of blood thinners because of other things, then in those situations we work closely with the local physician that's managing that patient for those conditions, and you as a therapist, of course, modify what you're doing to see how they do, and we work them through, and you can still get them through. We just take it easy. But what's great about Astym is it's a systematic approach. The therapists are well trained like yourself. They know what they're doing. They know when it works, when it doesn't work. They know when to use it, when not to use it. And I think that judgment and that knowledge that comes from good research and good data and all that outcomes data we've got really helps guide us treating patients in a much better way.
Yeah, no. And even when you mention, the neurological effects, obviously with a neurological patient, I see a huge neurological change. Somebody who can't activate certain muscles in their shoulder, and I do the Astym protocol, and then all of a sudden, boom, the muscle comes on. So there is definitely, that's a lot of what I try to do, is not only clean up the mechanics, the spinal mechanics, and then the soft tissue, and then we reintegrate, that whole nervous system reaction to getting muscles to quiet down and other muscles to turn on, so they're functioning, better. So then that whole, systematic approach is great, and that's where I love how Astym just fits right into that.
Well, and I think that's a good point you bring up, because again, what you do and what therapists, all good therapists, are trying to do is to reestablish normal movement patterns.
Yep.
We need to get the pattern back to normal. The way it's one thing you can reach out and pick up a coffee cup, but it's one thing to reach it out and pick it up like this, when your elbow's sore, versus, hey, we normally just reach out and pick up the darn coffee cup. Yeah. Everything changes. And if you've been doing this for a few months because your elbow's sore, you get sort of stuck that way mentally. Your neural pathways your software, so to speak, gets programmed to do this abnormal thing, which affects up your shoulder and everything else. And of course, like what you're talking about, we can clean all this up, but if you don't get them moving correctly and get the muscles firing like they're supposed to, like they used to, in a normal way, so that they're doing things correctly, you're setting people up for trouble. And I'm so glad that you mentioned that, because I think Astym helps the therapist like yourself reestablish normal movement patterns, because it helps you reprogram the software. Yeah. Because there's this abnormal pattern, you do Astym on the extremity or the area, and all of a sudden that pattern just sort of settles. The old not good patterns goes sort of away. It's almost like scratching an old DVD or a CD. It just erases the pattern. Yeah. And you as a therapist now, because you're not fighting that old pattern, you can get them moving normally, and all of a sudden things start to get reprogrammed up here. It's like, oh, that's the way it's supposed to move. Oh, I'm supposed to fire first, before and down the chain. And yes, I think it helps facilitate what you're trying to do, getting people to move normally, because now you're not fighting the old pattern anymore, because it scrambles it.
Absolutely. Well, this has been so helpful. Is there anything else that you want people to know about Astym, or any final words?
I think the most important thing is I'm excited that I've been able to be a part of a group to bring this forward. And I'm so thankful for folks like yourself who are people out on their progressive therapists that are looking, assessing, and finding the new things that really are the things that should be brought forward to the patients. And I would just encourage anybody that's listening anywhere, if you do have a problem with a chronic tendon disorder, if you have an old injury, an old surgery where you've got stiffness or recurrent pain or discomfort, something that's holding you back, find an Astym certified therapist and let him assess you, let him evaluate you. The nice thing about Astym is that it is safe, it's effective, it's non-invasive, no needles, no knives, no drugs. Mm-hmm. It works quickly, and it has a very high % success rate, well up into the 90s. Mm-hmm. So, don't put up with the pain or the limp or the problem or not being able to do what you want to do, even if it's I can't pick up my grandkids because I'm, get back to your life. And I guess your place, get back to normal. But do yourself a favor, get in there and see someone like Lisa who knows what they're doing and get your life back.
Yeah, awesome. Well, this has been so helpful, and I really appreciate you taking the time to share with our followers and to anybody who's listening about Astym. And thanks for all you've done to help bring this to the forefront, because it really has been a game changer for my patients and for my practice, and I appreciate it.
Well, thanks so much, Lisa. It's a pleasure, and thank you for having me.